In this video, I would like to discuss what you can and cannot do following small incision cataract surgery. With small incision surgery, there are no stitches and it's quite a robust operation and is in fact quite difficult to damage the eye. This compares to the old-fashioned technique where a big wound was created and lots of stitches placed, in which case it could be very easy to damage the eye following surgery, but this no longer applies to modern cataract surgery. Immediately after the operation, the vision can be a little blurred for the first 24 to 48 hours, and this is due to the fact that the pupil can often be enlarged for this period of time. The drops that are placed into the eye prior to cataract surgery are very powerful drops to enlarge the pupil, and it sometimes takes this length of time for the effect of the drops to wear off, and it is not until the pupil gets to its normal size that the vision becomes crisp. The eye can be a little gritty immediately after surgery, but there should certainly be no significant discomfort, and the discomfort should usually be alleviated with paracetamol. The most important thing after the operation is to ensure that the drops are instilled regularly, and they're normally required for 4 to 6 weeks, and the drop is a combination of an antibiotic to prevent infection and a steroid to damp down inflammation, and should be instilled 4 times a day. It's often easy to do it with breakfast, lunch and tea, and before you go to bed at night. The eye is often a little sticky and contains mucus, especially on the first post-operative day, and if this occurs, get some boiled water that's cooled down or some normal saline solution and a cotton ball and gently wipe away the mucus on the lid. But don't be afraid to touch the eye or touch the lid certainly, because it's quite a robust operation following small incision cataract surgery, and as I've already mentioned, it's quite difficult to damage the eye. The eye may also look quite red, and provided the eye is not particularly uncomfortable, just a little gritty, and provided the vision is good, that redness is likely to be due to a little hemorrhage that occurred with a blood vessel rupturing at the time of the local anaesthetic injection, and normally fades gradually over a period of a few weeks. So what are the do's and don'ts following a cataract operation? Well, you can bend over, pick up things straight away, showering within 12 to 24 hours, but try and avoid getting soapy water into the eye just because it's a little bit uncomfortable. You ought to avoid dusty environments for the first couple of weeks and also make up for a similar period of time. With regard to sport, I would suggest avoiding golf for about 1 to 2 weeks, and swimming and tennis, which are slightly more strenuous activities, I would avoid for approximately 4 weeks. Driving is also an important issue, and the driving basically depends on when you feel comfortable using both eyes together. So certainly not within the first 48 hours, but if after this period of time you feel you can see a number plate at the requisite distance, so pace it out at 20 metres, and provided both eyes are comfortable when being used together and there is no other problems such as loss of side vision, then you are allowed to drive from the legal